Do you know enough about Medicare to know which path you'll take when you get to retirement? Most people know Medicare will be their source of health insurance in retirement, but it's not as simple as flipping a switch. I'm Daren Chamblee, a certified financial planner and financial advisor with First Family Wealth. Let's simplify Medicare, breaking it down to the 4 parts and explaining the 2 routes that you might take. Medicare is really as simple as A, B, C, D. Those are the 4 parts of Medicare: Part A, Part B, Part C, and Part D. First up, it's Medicare Part A. This is commonly referred to as hospital insurance, covering any inpatient care you may receive. Beyond hospital stays, this can cover skilled nursing facility care, hospice care, and home health care services. You qualify for Medicare Part A if you're 65 or older and you're entitled to Social Security or railroad benefits. Separately, you can qualify for Part A if you're disabled and you've received Social Security disability benefits for at least 2 years. What does Part A cost, you might ask? For most people, Part A is free if they worked and paid Medicare taxes for the last 10 years. Next up, we have Medicare Part B. This optional coverage includes outpatient health care, doctor visits, home health care services, and other preventative care. While Part A is often free, Part B involves an annual premium and annual deductible. The third part of Medicare is referred to as Part C, or Medicare Advantage. It's more like an all-of-the-above choice than it is a separate part. You'll often hear commercials referring to Part C, or Medicare Advantage, because it's offered by private insurance companies approved by Medicare. These plans provide all the benefits of Part A and B, often with added perks like vision, dental, hearing, and fitness programs. It can also include Part D. What's Part D of Medicare? Part D is Medicare's prescription drug plan. It's designed to help cover the cost of medications. To get Part D, you'll need to have Part A, possibly Part B, depending on your circumstances, and pay a monthly premium for it. So now that we've covered all the 4 parts of Medicare, let's talk about the paths that you can take. Your first option is to enroll in an original Medicare plus Medigap. In this choice, you'd get Parts A, B, D, and you'd have Medigap, which is a separate supplemental policy to cover out-of-pocket costs like deductibles and coinsurance. In this option, the 2 biggest benefits are the flexibility of visiting any doctor or hospital in the U.S. that accepts Medicare, and the predictable out-of-pocket expenses. However, the drawback is that you may have higher premiums for Part B and Medigap. Option 2 is Medicare Advantage or Medicare Part C. Again, Medicare Advantage combines Parts A, B, and usually D into one plan and often includes extra benefits like vision, dental, and hearing coverages. This option is limited to a network of providers similar to how private insurance works. Along with less flexibility in coverage, you may have higher out-of-pocket expenses. That said, the biggest potential benefit is lower premiums. So now we've covered the 4 parts of Medicare: Parts A, Parts B, Part C, and Part D, and the 2 potential routes you can take to get your Medicare coverage. As you make your choice, remember that Medicare isn't just about coverage. It's about empowering you to live your life with confidence, knowing that you have the right support for your health and well-being. Whatever option you choose, the key is to be informed, explore your choices, and find the plan that fits your personal goals. If you need help in planning for retirement, don't hesitate to reach out to me at First Family Wealth. Let us help you put your retirement on cruise control.